Hi, I'm a clinical exercise physiologist and I help people treat and prevent heart disease. So speaking of heart disease, I want to talk about risk factors. Now there's some risk factors that are a little more risky than others. Some are a bit more risk enhancing. And then there's some risk factors that we can change and some we can't. So we're going to focus on the ones we can change. Those are called your modifiable risk factors, versus the ones we can't, which are the non-modifiable risk factors. And those are things like your age, your gender, your race, your family history. Unfortunately, family history, you can blame your parents, but there's nothing else that you can do. But it does pose a risk for you. If you have mom, dad, sisters, brothers who've had heart disease, then their chance of you having heart disease is a little bit higher. So what we want to do in that case is focus on our modifiable risk factors. So these are the things you can control. Now, we're not going to get into all of them and all the details, but I'm just going to let you know the modifiable risk factors are things like whether you're active or not, whether you have high blood pressure, high cholesterol, if you smoke, if you drink, if you have diabetes, what your stress is like. These are things that we can change. We can do a lot with that. Your weight is one of those things as well. That is, again, it's something where we have the ability to change, but it's a bit harder to sometimes. So these are all modifiable risk factors that we're going to focus on to help us deal with our overall heart health. So follow along and we'll go through each of them.